Aphorism number 59 Explanation. In this aphorism, Dr. Hahnemann has talked about effects of antibiotic and palliative remedy. He has explained primary and secondary actions of such antagonistic remedy through various examples. Important symptoms of chronic long standing disease have never been treated with such palliative antagonistic remedy, except the opposite state, relieved state, relapse, which is indeed most and markable aggravation of the disease occurs after few hours of amelioration, as for example for a persistent tendency to sleepiness during the day, if physician prescribe coffee, the primary action of it is to enliven, freshen up, but when its action gets exhausted, the day sleepiness is increased. For frequent waking up at night, physician prescribed opium without paying attention to other symptoms of the disease. This opium, by its primary action, produces stupefied, dull sleep and same night. But the subsequent nights were still more sleepless than before. For chronic diarrhea, without considering other morbid signs, if the same opium is given whose primary action is to constipate the bowels after temporary stoppage of diarrhea, afterwards it became all the worst. Violent and frequently recurring pains, physician could suppress it with opium. For the short time, the pain then always returned in greater and even in more intolerable severity or some more worse affection. Sufferings came instead of pain. For nocturnal cough of long standing, the ordinary physician knew no better than to administer opium, whose primary action is to suppress every irritation. The cough would then perhaps cease the first night, but during the subsequent nights it would be still more severe. And if it were again and again suppressed by this palliative, in increased doses, fever and nocturnal perspiration were added to the disease. Weakness of the bladder with consequent retention of urine was sought to be conquered by the antipathic work of cantharides to stimulate the urinary passages, whereby evacuation of the urine was certainly at first affected, but thereafter the bladder becomes less capable of stimulation and less able to contract, and paralysis of the bladder is imminent. With large doses of purgatives, drugs, and laxative salts, which excite the bowels to frequent evacuation, it was so soft to remove a chronic tendency to constipation. But in the secondary action, the bowels became still more confined. The ordinary physician seeks to remove chronic debility by the administration of wine, which, however, stimulates only in its primary action. Hence, the forces sink all the lower in the secondary action by bitter substances and heating condiments. He tries to strengthen and warm the chronically weak and cold stomach. But in the secondary action of these palliatives, which are stimulating in their primary action only, the stomach becomes yet more inactive. Long standing deficiency of vital heat and chilly disposition ought surely to yield to prescriptions of warm baths, but still more weak, cold, and chilly do the patients subsequently become. To remove chronic tendency for constipation, large doses of purgatives, drugs, and laxative salts are given, which excites the bowels for frequent evacuation with its primary action. But in the secondary action, bowels become still more confined. In case of chronic debility, ordinary physician gives wine, which stimulates in its primary action, but in secondary actions all energy sinks down. Physician tries to strengthen and warm the chronically weak and cold stomach by giving bitter substances and heating condiments, which gives stimulating action in its primary action, but stomach becomes more inactive by its secondary action. In case of long standing deficiency of vital heat and chilly disposition, if warm bath is given as treatment, then first patient feels good and feels warmth, but after that subsequently patient becomes more weak, cold and chilly by its secondary action. By application of cold water, severely burnt parts feel better instantly, but the burning pain afterwards increases to an incredible degree, and inflammation spreads and rises to a still greater extent. Coryza with stoppage of the nose is removed by means of stra- sternutatory remedies that cause sneezing, but it is missed to observe that disease is aggravated all the more by these antagonistic remedies in their secondary action, and the nose becomes still more stopped. Chronically weak and almost paralytic limbs were soon excited to more active movements by electricity and galvanism, which in their primary action greatly stimulates muscular action, but in secondary actions the consequence was complete deadening of all muscular irritability and complete paralysis. To remove chronic determination of blood to head, venesection was attempted, but it was always followed by greater congestion. To treat the paralytic torpor of the corporeal body and mental organs conjoined with unconsciousness which prevails in many types of typhus, ordinary physicians know nothing better than with large doses of valerian drug, because it is one of the most powerful medicinal agents for causing animation and increasing the muscular power. But in their ignorance, they were not knowing that this action is only a primary action. After this primary action gets over, the patient most certainly falls back in its secondary action into still greater stupor and immobility, almost to paralysis of the corporeal and mental organs and death. They didn't see that in many diseases they supplied most plentifully with valerian drugs, which is such cases act as oppositely acting antipathic remedy, mostly infallibly. Such cases terminated fatally. The old school physician become happy that he is able to reduce the velocity of the small rapid pulse in cachectic patient with the very first dose of uncombed purple foxglove, which in its primary action makes the pulse slower, but its rapidly, however, soon returns in its secondary action. Repeated and increased doses gives lesser effects, smaller diminution of rapidity and for shorter period, but in secondary action pulse become uncountable, sleep, appetite and strength deteriorates, and speedy death is the sure result, or else insanity may develop. How often in word I can say that the disease is aggravated or something even worse is effected by the secondary action of such antagonistic antipathic remedies. The old school with its false theories does not pursue, but experience teaches it in terrible manner.